I'm from the Community Health Center, which is a community non-for-profit agency that seeks to be the premier substance use disorder treatment provider for Summit County. So basically, we treat substance use disorders and other co-occurring mental health disorders. An important current trend for everybody to be aware of is the use of prescription and over-the-counter drugs among youth. Currently, 1 in 5 will have abused prescription medication to get high by the time they're a senior in high school, and that's the drug of choice for 12 and 13-year-olds. It's also important to realize that when youth have substance use disorders, that are higher risk for suicide and also for accidental overdose, which is also a leading cause of death among youth. So at Community Health Center, we do provide individual and group counseling services. Any Summit County resident is eligible. If you do refer somebody to us, like say a school refers somebody to us, we can provide a really nice written assessment of, if we believe the student does have a problem or not, and then what our recommendations are for that student. If they do decide to engage in treatment, we have ongoing collaboration with the schools. We communicate with them about how the student is doing, what their drug screens are, what their attendance is, and what other needs they may have. Something I'm excited about is we recently also started to provide animal-assisted therapy. So we have a licensed therapy dog named Waffles. There's pictures in the back on our brochures. And then in January, we're actually starting an intensive outpatient program at Community Health Center. And another new initiative is doing video therapy, and we're actually offering to provide web cameras and computers to local schools free of charge, and to provide training to key staff members free of charge in order to do substance abuse treatment that way to try to help reduce stigma for students and reduce barriers to treatment. A lot of times students with substance use disorders are seen as bad kids. They're not recognized as having a mental health problem, and we really want to emphasize these students also need treatment and intervention. So a good way that engaging in substance abuse treatment can help your students is most of the time, by the time we see your students, they have significant problems with school attendance, school performance. When they do go to school, they're sleeping or they're argumentative, they're having mood problems, and they're at risk for dropping out of school. And so if you send them to get the appropriate treatment, a lot of times once they achieve sobriety, those things improve right away, and so it's really encouraging. We also appreciate referrals from schools because students still have you guys as a positive support system. So that's 6 or 7 hours a day. They're in a sober, structured environment with support.